Make sure that the subject has not had any nicotine or alcohol for at least 30 minutes prior to the assessment, and that they have been seated at rest for at least 5 minutes prior to the assessment. Also, you want to make sure that the cuff is the appropriate size for the individual, because if it is too large or too small, it could alter their blood pressure readings. When taking blood pressure, be sure to have your stethoscope, your blood pressure cuff, and your manometer. Make sure that the subject is seated with their back against the chair and their palms facing upward to expose the brachial artery. The subject's legs should be uncrossed and their feet should be flat on the floor when doing the blood pressure assessment. First, you will check the subject's pulse to locate their brachial artery. After doing so, you will take the cuff and place it on the subject's arm between their elbow and their shoulder. Make sure that the subject's sleeves are rolled all the way up to fully expose their skin. Before securing the cuff, you're going to line it up with the brachial artery. Most cuffs will have a line indicating where the artery goes in location to the cuff. Then you will fully secure the cuff, take the manometer, and place it on the cuff in an area where you will be able to read it while taking the blood pressure. You will then check the bulb. Make sure that the valve is turned all the way to the right so that the air will not be released when you're filling up the cuff. The earplugs on the stethoscope should be facing forward when you place them in your ears. And then you will tap on the stethoscope to make sure that it is properly working. Place the stethoscope below the cuff on the brachial artery. Then you will begin filling up the cuff to about 180 to 200 millimeters of mercury. Once you reach that limit, you will turn the valve to the left to start slowly releasing the air from the cuff. You will begin to hear a thumping sound. The first sound that you hear will be the systolic reading, which is going to be the highest number, and the last sound that you hear will be the diastolic reading, which will be the lowest number. Those two numbers will be the ones that you record for the individual's blood pressure readings. Once you have finished taking the individual's blood pressure, you may remove the cuff from their arm and let them rest for at least 5 minutes before retaking their blood pressure. This blood pressure chart shows the different categories in relation to the systolic and diastolic values. You have your normal, prehypertension, hypertension stage 1, hypertension stage 2, and hypertensive crisis categories.